Hi folks, Tina's Pilates again. Now, I don't just teach Pilates, most of you know that I'm also an osteopath as well. And I have been asked to give you my go-to exercises for back pain. Now, there's a lot on social media about whether you need to strengthen certain muscles, you need to lengthen certain muscles. The truth is you need to have both long and strong muscles. The thing is that when you get a back pain, let's look at back pain first of all. What tends to happen is it's either traumatic or it's postural. Hopefully it's not pathological. If it's pathological, then it's not necessarily just a straightforward musculoskeletal condition. And I'm not talking about conditions that are slightly more complex. I'm talking about a musculoskeletal condition that is brought on because of mild trauma or because of some form of postural element. Maybe it's that you were washing your car and your back has gone into a bit of spasm because it's reacting to a move or a movement that you don't normally do, or you don't normally do it with such intensity or frequency. So under those circumstances, what happens is the muscles act like a natural splint and they get tight. And they're getting tight to protect the area, and that tightness also produces pain. Pain is that, again, it's a natural reaction to stop you doing anything else in that moment to make it worse. Most of these things will be self-limiting and they will be able to give you release over time. Some of that will depend on how active you are or you're not. And it's also part of that body self-healing mechanism as well. But I have 3 exercises that are my go-to exercises. If you have lower back pain, I would do these 3. One is more important than the other, but I would do these 3. So let me give you those and we'll get going. So the first one is straightforward, preferably on the floor, not on a mattress. It's too soft, but you're going to lie down. You're going to have just a nice length through the neck and through the spine. I'm going to pick my bottom up. I'm just going to pop my back down on the floor as much as I can. Now, this is obviously assuming that you can do this comfortably. But the first exercise is just bringing both the knees up, clasping over the top if you can, underneath if you have some knee difficulties, and pull the knees up towards the chest. Now what we're trying to do with this is just give a generalised stretch to your lower back. The mechanics of lower back pain I'll discuss again, but we're just creating a stretch into your lower back. And I want you to just let that stretch ease a little bit. Now once it begins to ease, you can do a gentle rock either side of the midline. So your midline is from your nose to your belly button out. And you're just almost pushing and massaging your lower back and the lower back muscles into the floor. Okay, so that's a nice one. It's also nice to do in the morning, even on the mattress, before you get out of bed. The second exercise, generally people talk about back pain including into the very top of the pelvis. So the other exercise that I would do is have one leg down flat, clasp the knee with the opposite hand, pull it across the body, and then a bit of an uptick in towards the opposite shoulder. I do not want you to rotate all the way around. It's a good exercise, it's good, it mobilises the spine, but in terms of 3 exercises to give you back pain relief, it's a pull over and up. So you're keeping your back fairly flat on the floor to get a stretch down through the back of the hip. Now with all my stretches, I want you to listen to the body. I do not want you to count to 20, 30, 40. Your muscle will be at a different, if you like, tension level to mine. So if we both count to 20, we will get different results. What I want you to do is listen to your body, don't push, don't rock, and wait for it to change. So once you pull that leg over, find that stretch. If you need to increase it, take it over again or pull it up in towards that opposite shoulder, get your stretch. And I want you to hold the leg still. Now what you can do is hold the leg with this front muscle, and I don't want you to do that. I want this exercise to be as passive and as relaxed as possible. So if you take your hand away, your leg would drop. So switch this muscle off. If you're feeling it pinch in the groin, two things are happening. One, your hip flexors are extremely tight, and I'll come on to that exercise in a moment. Or the other one is that you're just not able to switch the quads and the hip flexors off. So if that's the case, I want you to just tighten your muscle and relax it. Tighten it again, you'll feel it pinch. Relax so that you know that that movement is nice and relaxed, nice and passive, and you can pull it across. The leg is relaxed, no tension in the groin. If you struggle, you do get the tension into the groin, stop and do the third exercise before you do this one. So we're going to wait. I'm going to wait for that stretch to ease, and it could take 30, 40, 50 seconds, and that will feel like forever. But once you begin to feel it easing, and some people will say to me, just feel like I'm getting used to it, that'll do. Take it across again. 1/8 of an inch, just a little bit, just till you feel that stretch again, and wait. Wait for as long as it takes to ease. If you're feeling it in the groin again, try and relax, or go and do that third exercise. Once this stretch relaxes, pull it across that third time. And then you're going to swap and do it on the other side. So today my right's a little bit tighter than the left, so I'm going to pull it across. I wait for it to change. Everything else is relaxed, there's no pinch in my groin. I'm waiting for that to change, and then I'll pull over a couple of mil, 1/8 of an inch, a little bit more, wait for as long as my muscle takes for it to change, then a third time. So that's going to give you, if you've got that bar pain across that middle part of your back, that's going to give you some relief. The third exercise is an important one, and this is your hip flexor. So we're going to lift up through, and we're going to come up onto one knee. Okay, now from here, we're going to lift and hold. Now, if you've joined some of my other videos, you'll know that I talk about dots, because dots are easier to work with. So you've got a dot at the top, just in between the ribs, and a dot on your pubic bone. Now with this exercise, I want you to concentrate on bringing this bottom dot up. Now it's not a bum squeeze. It's pulling your tummy up, and you can see that lift through the front. If I turn onto the side, as I'm lifting up, I'm flattening my back, I'm pulling into my tummy muscles, but I'm getting a stretch on the thigh and the leg that is down. Now, the way I also describe this to people is if you think of a frightened dog that tucks its tail underneath, that's the movement I want. That tucking under, tuck your tailbone, lift up through the front. You're not sinking into it. You're not leaning forward of it. You're keeping that posture upright and pulling up through the front. And the stretch that I want you to get is in the front muscle. So you're pulling up, this knee is in front of the hip, the foot is in front of the knee, you're not allowing it to twist out, you're not to the side, and you're not over forcing it. You are lifting until you feel a comfortable stretch, and you wait until it eases. If you haven't got any balance, hold on to something. It doesn't matter, it's not about balance, this exercise, it's about giving you some mechanical relief for your back pain. Now this is almost like a magic back stretch. You are not supposed to feel it into your back. If you are, you're probably leaning, or you're squeezing some of the muscles that are already tight. So it takes a little bit of effort, a little bit of time to get used to this. It is a pull in through the front. Stretch some of your hip flexors, wait. You wait that 20, 30, 40, 50 seconds until it eases. Don't come off it, lift again. Now this incremental move is quite small, so you won't get big movements, but you're going to lift, let it ease, lift, let it ease, and a third lift. And by the time you get to that third lift, there's almost nothing left. It's a tiny little pull up through the front. Get that stretch, wait for it to ease, and then relax and swap sides. I would encourage you to do it on both sides, because without being able to have a look at myself, I don't know which is the tighter side, but you will, because by the time you swap it and lift, one side is only going to feel easier, it's going to feel like more easy to do, you can get that movement through, or you're going to think, oh my goodness, this is really tight on this side, and you're almost having to just lift that little bit harder to get that stretch, or you're just going to be a little bit more cautious with that side that's really tight. But again, it's a lift, let it ease, lift, let it ease, lift again. Don't lean back, don't lean forward, get the stretch in through the front of the thigh and allow it to ease. Now, there are other wonderful stretches, but I've been asked for my 3 go-to, and out of the 3, if you have no time to do any of them or just one of them, this is the one that I would recommend. So it's not perfect without being assessed, and you might want to go to an osteopath, chiropractor, physio, even just a massage therapist, sports massage, someone who knows the anatomy and is able to tell you what your diagnosis is. But these are my go-to stretches for some basic musculoskeletal pain. Have a go and let me know how you get on with them. Take care. Bye-bye.